Next, we have a therapeutic communication question. It's everybody's favorite, right? But chances are you're probably going to see a lot of therapeutic communication questions on the NCLEX because it's really important as a nurse, right? Okay, so let's see what we have in this question. So we have a nurse who's talking with a client who recently experienced a significant loss, and the client states, "I'm doing fine, everything's okay." However, the nurse notices the client is frowning while they're speaking. Okay, and then we're being asked which of the following would be an appropriate response for the nurse to make. Okay, so we have a lot going on in this question, and we're being asked what's the best response that we can make in this situation? So what are we really being asked here? So the client's saying everything is okay, but they're frowning. So what does that mean? It means that we have incongruent communication. So we have this incongruency between verbal and nonverbal cues. Okay, so we need to get to the bottom of that, right? So as nurses, we need to find some way to elicit more information about what's happening here with this client. So how do we do that? How do we do that in a therapeutic way? Well, let's review what we know about therapeutic communication. So therapeutic communication falls into kind of three big categories. The first is that we need to be active listeners. And so these are just statements kind of summarizing what the client's saying, kind of encouraging them to go on. And basically these are statements that say, "I hear you, I'm listening, I'm following along with what you're saying," right? Keep going. And then we usually follow those up with an open-ended question. And so these are questions that elicit more information from the client. So tell me more about what happened. Tell me how that made you feel. I'd like to hear more about that, right? And so they give the client lots of opportunity to express what they're feeling. And then lastly, as we make these statements, we want to make sure that they're non-judgmental, right? Because nobody likes to feel judged. And so if we make statements that feel judgy, clients are going to shut down and probably not want to talk to us. So I can give you an example of this. So say I ask you, I say, "Tell me how you're studying for the NCLEX." And you're like, "Oh, well, I'm doing this and that and what have you." But if I ask you, "Why are you studying for the NCLEX like that?" You're going to say, "Ooh, I don't know." And you're not going to want to answer because that last statement, if I say, "Why are you studying for the NCLEX like that?" I'm kind of implying that you're doing it wrong, right? And that doesn't feel so great. So nobody wants to feel judged. So we want to make sure that we're very non-judgmental when we're communicating with clients. So let's go back and take a look at our answer options and see if we can figure out which one feels like it's going to get us the information we want. It's going to tell us what's going on between this incongruent communication, and it does so in a non-judgmental way. Okay, so our first option is, "I can see that you're feeling upset. Tell me more about what's bothering you." Okay, so I like the second half of the statement, "Tell me more about what's bothering you." It's a nice open-ended question, but when we're saying here, "I can see that you're feeling upset," we're kind of putting words in their mouth, right? We're kind of making a judgment of like, you look this way, therefore you are upset. And so now if I said, "You seem like you're upset," that's different. But if I'm saying like, "I can see you're upset," it's kind of a judgment because the client might be like, "That's just my face. Like I'm not upset," so we don't want to make judgments about how they're feeling. Okay, so I'm going to say I think we can probably find a better option. So let's look at number 2. "Okay, I understand. If you want to talk more about about how you're feeling, I'm here for you." Okay, well, it's nice that we're offering support, right? We're saying I'm here for you, and we're saying like, "Okay, I understand what you're saying." But does this help us get to the bottom of this verbal, nonverbal inconsistency? Not really, right? We're not asking anything. We're just saying like, "I'm here for you," and they're going to say, "Okay." So we're not really asking any question there at all. So that's not really going to help us get to the bottom of what's happening. So let's look at number 3. "I'm glad to hear everything is okay. Is there anything specific you'd like to discuss today?" I don't really like this one at all because we're saying, "Okay, I'm glad to hear everything's okay," even though we see that everything's likely not okay. And then we follow that up with a close-ended question saying, "Is there anything you'd like to discuss today?" What are they probably going to say to this? They're probably just going to say no, right? That's just a yes or no question, and they're probably just going to say no. Okay, so hopefully number 4 gives us a better option here. "You mentioned everything is fine, but your facial expression seems to show otherwise. I'd like to hear more about that." What do we think? I like this one. And I like it for a couple of reasons, because we're just observing what we're noticing, right? We're saying everything, like you mentioned that everything's fine, but your facial expression seems to show that it's not fine. Like these don't seem to match. We're just kind of giving an observation here. And then we follow that up with an open-ended question of like, I'd like to hear more about what's happening here, right? And so then they're going to say, okay, well, actually I feel this and that way about it. So number 4, what do you guys think? That's probably going to give us the most information, and it does so in a non-judgmental way. Should we see if we're right? Yes, we are correct. Good job.